All right, let's move to the self-care bubble and just emphasize a few things. One is that, as you probably know, taking care of yourself is incredibly important. You cannot be giving others all that you want if you're not taking care of yourself. So just remember to find balance. Giving of yourself needs to be balanced with giving to yourself. And so if you're thinking, I just don't have time for that, you really don't have time not to do that, because you're not going to be there for the people that you care about if you're not taking care of yourself. One thing that we in our office like to use is this self-care wheel, which reminds us that we have several dimensions to our well-being: psychological, emotional, spiritual, personal, professional, and physical. And the wheel lists different kinds of things that can benefit you in those particular areas. And just remind yourself that there is a balance, that you can't just focus on your physical well-being. You also need to nourish your spirit. You can't just focus on your professional success. You also need to look at other aspects of yourself and make sure that your emotional well-being is addressed. So please download this self-care wheel and use it to prompt you to engage in activities that address your entire well-being. I would also urge you to check out our coping with stress webinars that we have available on our website. Visit familyware.org/trainings, and there you'll find many, many different strategies for coping with stress. There's one that emphasizes stress in the workplace. There's another that emphasizes mindfulness as a form of stress reduction and stress management. Now, let's just check back in with Becky about what she did for taking care of herself.
It was very difficult to stay well and maintain my wellness during this time. But how did I do it? Right away, I found a great therapist that was critical to helping me sort of figure out my own feelings, as well as figure out the mental health system. I had no idea how to navigate it, and I would come to her and say, this is happening, or the hospital is releasing him, or these insurance payments are so much, and she would validate that was true, and I wasn't doing anything wrong. It was just true. So it was really difficult for a long time. I didn't feel good for a long time, but I fortunately was able to function and get my husband some help. I remember during that time, the first feeling that I felt every morning when I woke up was dread. There was nothing for me to look forward to in a day. I knew how hard the day ahead of me was going to be based on how hard the days behind me had been. And the thought was, even if he got better that day, so much damage had been done to everything, to our relationship, to him, to me, that it just didn't seem like there was ever going to be a reason to be happy again. Yet we kept going. And, people along the way would say to me during this time, you look awful. You look really tired. And which is a lovely thing to say to someone going through hard things, but we do it all the time, don't we? But really, I'd say I look awful because this is awful, and I feel awful, and this is really hard. And so, I guess I just went through a couple of years feeling and looking kind of awful. And one of the things that it's going to sound a little weird, but I had this thought early on, like during the first few months, and it was, what if someone told me that it would take 3 years of going through life this hard, and then I could have my husband back? Could I wait it out? Would I make it? And for some reason, that number stuck in my head. Let me give this 3 years of giving it all I can give and see what happens. And, so when you take away the needing to have things resolved in the next 2 weeks, you give yourself some freedom that this is going to take a while. It did free me up a little bit. And it really helped me get through, because as you're caring for a spouse, you're not getting anything in return. You're often not getting a hello or a good job or any validation, but you keep going. And, ironically, it took 4 years for him to get well, but having that thought that it was going to take a couple years helped me keep going initially. Another one of my saving graces, honestly, was that I was an avid Zumba girl, and I took 3 or 4, maybe 5 classes a week during that time. So I was around positive, strong women. When all this happened, I missed a few classes, but I pretty consistently went to class still, and it was a welcome relief, a great way to get out of my overworked brain and to laugh and to be around just other people in life, doing something that was good for me. So it sounds little, but it was huge to me. It still is. Another way that I survived was I built a life around him and without him, which sounds terrible because in our marriage, we'd spent all these years together, moving closer together. And here to survive, I had to separate mentally a little bit from him. So I would drag myself out to visit friends and I say drag because it's really hard to go out and try to have fun when your whole world is imploding, but I would try to say yes to invitations. I would go alone. He wouldn't go anywhere. We always had been 2 peas in a pod, but I developed interests very separate from him. I didn't tell him anything about my life for years, and honestly, he didn't ask. He couldn't care. He's a great guy, but he could not care. And I can't say it wasn't upsetting at times. I know, like, logically, he was the one that was on the front lines, dealing with this illness, fighting for his life every day. He was on the front lines, but in many ways, I took a hit too. I definitely took the hit financially, and we'd never had a lot of resources like a lot of people. We're just average income people, but when he was sick, I gave up a lot to cover everything that he needed. And there were absolutely years where I would think, I just need to get away. I need a vacation. I need just time to get away from all of this. And you know what? I couldn't because we didn't have the money. And yes, I could charge it, but I'm the one getting the bill next month, and that caused more stress for me. So, that was tricky. I wasn't bitter, but I wasn't happy at how limited our lives were during that time. And so, one of the stories that kind of makes me laugh is that after one of his hospitalizations early on, I was kind of getting used to it. And so I spent the 8 hours or whatever it is in the emergency room, taking care of him, getting him admitted, exhausted. I texted our group of people that needed to know he'd been admitted again in the hospital, shut my phone off, and I went to the shoe store and I bought myself these wonderful maroon boots. And I thought to myself, you know what? Anytime he goes into the hospital, I'm getting new boots. And it sounds funny, but it was a little moment of self-care for me, and I did end up with several new pairs of boots that year. But it was sort of a learning to, no matter what happens, no matter how bad this is, you can take care of him, but you need to take care of you too. So that is another means of self-care that was really personal to me.
Thank you so much, Becky. I'm not sure that new boots would be something that I would have thought of, but it sounds like it worked out really well for you. And I know that people can be inspired by that, not to get new boots necessarily, but to find the things that can make them recognize that they need attention too, that they need something good for themselves, even in the midst of all that is going on. But let's look at just a few things to consider that you might do. Setting boundaries and maintaining them is something that can help you avoid frustration and anger and make you feel good about yourself. So whether that's that you're setting financial limits, that you are carving out time for yourself that you will not allow to be interrupted, whatever your areas of boundaries, and certainly there are several areas that would be applicable all at once, be firm. Be clear, be consistent, be kind, but respect yourself and know that you have set those boundaries for a reason, and that reason is your own well-being. It's perfectly reasonable to acknowledge your worry and to accept it, but also find ways to manage it. Practice self-care in whatever way or ways are workable for you, and lean on your support network, whether that's someone who can step in and do some of your day-to-day tasks, whether that's someone removing you from your situation for a while and getting your mind off it and being able to focus on something else. Just make sure that you surround yourself with people who are there for you in whatever ways you require. All right, let me just take a couple of minutes to talk about Families for Depression Awareness. We are a national nonprofit, and we help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We believe that depression and bipolar disorder affect the whole family, so everyone should get the attention that they need. We see the caregiver as the linchpin because not only will they recognize that there is a problem, they will be motivated to do something about it, and they will be in a good position to access resources to get a loved one the care that they need. Our website is a trove of information and resources available to help caregivers dealing with any mood disorder. Please plumb its depths and find information that is useful to you. We have tools that are online, including our mental health family tree, which is useful for helping to diagnose bipolar disorder. We have our depression wellness analyzer, which allows people to set their own wellness goals and then track how they're doing with regard to them. And also our depression and bipolar screening test, which you can take anonymously and confidentially and print out the results and take them to your provider. We also offer other free webinars in addition to this one. We have our teen depression series, which now includes a webinar on teen anxiety. We have our coping with stress series, which includes workplace topics and also other parts of life. We have our bipolar disorder series, and we also have our More Than Mood Depression Symptoms webinar, which goes back to the areas of thinking that can be affected by depression, which we call ROAM for reasoning, organization, attention, and memory. We also have a number of publications, including our new handbook, which is helping someone with depression or bipolar disorder. We have always provided family stories for inspiration and to reduce people's sense of being alone. And we have new brochures of stories with regard to adult depression and with regard to adult bipolar disorder. We thank our volunteers for their participation in those. They are truly generous in sharing their stories with us. The Coping with Stress brochure is something that I can send to you if you take our survey. And also our Adult Depression Wellness Guide provides a lot of valuable information and gives people a way of monitoring their treatment. I would like to say a big thank you to the people who have helped us in putting this webinar together. Joanne Cohen-Veda and Dawn Flores were great volunteers for applying their expertise so that we could offer you this information. Suzanne Curry is co-director of policy and government relations at Healthcare for All. She also was generous in her review. And our presenters, Becky, Hannah Fergan, and Wells Wilkinson, and the organizations Healthcare for All and Health Law Advocates were very supportive of us getting this done and out to you, and we thank them. Also want to thank our program sponsors, the Allergan Foundation, the Commonwealth of Massachusetts Department of Public Health Suicide Prevention Program, and the Takeda-Lundbeck Alliance. Our corporate members also support all of our programming, and those include Janssen Neuroscience and Sage Therapeutics. I'd also like to thank you. You've just spent a whole bunch of time with us, and we appreciate your interest. Our work is made possible by generous contributions of people just like you, so please consider making a tax-deductible contribution to us at familyware.org/donate. We appreciate it. To wrap up, please complete the survey at www.surveymonkey.com/r/healthins2019, and we will send you that brochure. Please watch the caregiver and insurance videos on our website and on our YouTube channel. While you're at the YouTube channel, please subscribe and like us on Facebook, follow us on Twitter, and share. We appreciate you sharing our social media posts as well as webinars like this. If there's anyone you believe would benefit from this information, just send them a link and they can access it for free as well. And explore our site, familyware.org, for more about mood disorders and being an effective caregiver. We greatly appreciate your time and your interest. Thank you again. Take care.